Good morning. Today we are starting the new lesson, that is CWSN, Children with Special Need. And the name of the chapter is Physical Education and Sports for Differently Able. So this chapter we will study about various type of disabilities, disorders, and what are the how do we treat these people, and what are the etiquettes. So, concept of disability and disorder. First, the concept of disability and disorder are two separate terms that stands for different type of physical and mental conditions. It is clear? Concept of disability and disorder. Disability and disorders are two separate terms and they stand for different physical and mental conditions. The concept of disability we will discuss first. The term disability means any kind of impairment or permanent reduction in physical or mental capacity. Getting impairment or permanent reduction in physical or mental capacity. The reduction can be related to any kind of physical loss, mental illness, intellectual impairment, and reduction in the use of sense organs. This may be present from birth or may occur during the person's lifetime. This affects the person's participation in different area of life and reduces the full use of body structure and function. So overall, what we understand by the concept of disability means the disability is when the person cannot make full use of his or her body structure. He or she cannot utilize their body organs to function efficiently, or that is any kind of loss, physical loss, mental loss, partial organ loss, or permanent organ loss. So this is the disability, and it may be since birth. Unfortunately, some of the person they suffer with the disability since birth. Like I can give you example of the Hiroshima and Nagasaki, then where the atomic due to the atomic war, still the disabled children are taking birth. So the disability is maybe since birth, or it may occur during a person's lifetime. So many examples are there due to an accident. The person becomes disabled, they have to lose certain body parts, organs, they have lost certain body abilities, either physical or psychological, so whatever it is, means that is any kind of loss, physical loss or mental loss, or it is sometimes it is caused due to illness like polio. Other so many diseases are there. The person becomes unable to perform the daily routine activities efficiently and effectively. So this is the concept of disability. I think disability is clear. Now disorders. Concept of disorders. Disorders is any ailment that disturbs the health of a person. That's why it is known as disorder. Hinder a person's performance and diminishes his her his or her efficiency. Disorder grow inside a person. They are small in beginning but may become serious and grow into a disability. There are many kinds of disorders like mental disorders, neurological disorders, hyperactivity disorder, eating disorders, addiction disorders, attention disorders. So disorders we can understand more. It we can consider as the dysfunctioning of any organ, any system of the body, which arises inside of the individual. Its main causes ailment, diseases, or other effective causes are there like lack of nutrition, improper growth, etc. So disorder is the situation in which the person's body functions are not working properly, either one or more functions, either one functions of the body or more functions of the body are not working properly or not working at all. Disorder, or it may be structural, it may be functional. Structural means the shape and size. It may be functional, where we come to the functions of the organs and the systems of the body. So this is about the concept of disorder. I think disorder is clear. We can clearly understand the disorder by this topic that I have discussed over here, concept of disorder. I am coming to the next topic in the next slide, that is type of disability. There are three type of disabilities, which are as follows: cognitive disability, intellectual disability, and physical disability. The three type of disabilities are there. We will discuss these disabilities in detail. Cognitive disability we are discussing first. Cognitive disability, the nature of this disability is mental, since cognitive domain is related to using mental abilities and achieving results from it. So cognitive means that is it related to the mind. It is related to impairment in intellectual functioning and adaptive behavior. Just try to bring your attention here, intellectual functioning and adaptive behavior. So what is intellectual functioning? What is adaptive behavior? So intellectual functioning means person's ability to plan. Intellectual functioning means person's ability to plan anything, comprehensive and reasoning abilities, problem solving, creativity. It also includes learning and other faculties of the brain. So intellectual functioning we can understand. Intellectual functioning means that is person's ability, planning ability, how the person can manage the things, how the persons have choices, select how the person the selection abilities, comprehensive and reasoning abilities, how the person use his intelligence to solve the problems, to find out the solutions. While adaptive behavior refers to applying social and practical skills in everyday life. Children suffering from dyslexia, learning difficulties, speech disorders, problem in solving maths calculations, short span of attention, and short of memory are said to have cognitive disability. So, adaptive behavior, then I will tell you, these all are in the cognitive disabilities. Children suffering from dyslexia, learning difficulties. Dyslexia is the psychological disorder, psychological problem. Learning difficulties, speech disorders, problem in solving math calculations, short span of attention, and short of memory. These are the cognitive disabilities. Adaptive behavior, I will tell you, then you can understand more easily. Adaptive behavior, like which we learn from society and practically apply in our life, everyday life, like dressing sense. We see someone is dressing like this way, so we like it and we try to dress up in the same way. We try to opt various habits from the society, from the people of the society. That is adaptive behavior. That's why sometimes we see I'm more clearing it than you can understand. Sometimes we can see the people are suffering with some psychological problem, so always they are always wearing dirty clothes, they are always remaining dirty themselves, and they are not bothered about dress, how they are wearing, what they are wearing, hygiene of the body, hygienic things. They are not bothered about anything. So that is because of the adaptive behavior. They are lacking the adaptive behavior. Adaptive behavior means then that's why they are not that faculty of the brain mind is not focusing that society in social society the peoples are wearing clean clothing, peoples are living in such a manner that they looks good, they always clean themselves, but these people are not bothered about anything. So during the cognitive disability this happens, the person's intellectual functioning and adaptive behavior is disturbed. Adaptive behavior, you can understand, that's why we can see these type of people who are suffering with psychological problems, severe psychological problems. Maybe that behind the cause we are not discussing right now, but these people remain dirty always. So they they'll also, if we ask them, so they will say then that yes, hygiene is good, but they are not bothered about it. Just for a moment they will say yes, that is good, but that is not their attention. They are not uh, you know attentive, and that is not in their mind that they will think about it for a short a while. They can understand, but immediately they will forget about it because that is not in their behavior. They have not adapted it from society. That part of the mind is ignoring these things, and that part of the mind is ignoring the adaptive behavior. So that's why this is now I think it is clear the adaptive behavior to all of you. Coming to the next, the causes of cognitive disability. Causes of cognitive disability. Cognitive impairment may be present at birth and may be genetic or chromosomal or result from complication of pregnancy. So cognitive disability, and sometimes the cognitive disability is present since birth, but it is not genetic. The question is there, cognitive disability is genetic, heredity? No. Cognitive disability may be present since birth. Very rarely it is genetic, but it is not genetic or chromosomal. But most of the time it can be seen that it is result from the complication of pregnancy or complication during the birth of the child. very rarely it is genetic. That's why the cognitive disability is maybe since birth but not genetic. Chromosomal abnormalities may be there. Certain cases that we have discussed in previous slide, that due to environment factor, due to anything, the chromosomal abnormalities are there. The chromosomes are changed in such a way, such an abnormal way. Prenatal drug or infection and exposure to alcohol. Prenatal means that is during this pregnancy, before the birth of the child. Drugs and infections and exposure to alcohol may lead the cognitive disability. Lack of oxygen during the labor pain or birth. Labor pain means when the lady give birth to a child, that pain is known as labor pain. Lack of oxygen during that time. So these are the causes of the cognitive disability, and cognitive disability may be since birth but not genetic. But sometime, very few cases, it may be genetic and chromosomal. Intellectual disability. Next. The nature of this disability is also mental, since the intellectual domain is related to the using capacity of the mind. It is a disability characterized by significant limitations in both intellectual functioning and adaptive behavior. Now, just bring your attention again here very clearly. Cognitive disability and intellectual disability are different. Why? Because cognitive disability, the totally intellectual functioning and adaptive behavior is responsible. But in case of intellectual disability, the limited area of the adaptive behavior and intellectual functioning is responsible. Only limitations are significant limitation in both intellectual functioning and adaptive behavior. Because intellectual functioning and adaptive behavior are both related to each other, that's why the intellectual disability is also caused by both these functions. Intellectual functioning and adaptive behavior we have discussed in detail in previous slide. So this is characterized by low intelligence. What is intellectual disability? Characterized by low intelligence and significant problem in the way which learners adapt to new situation. It is different from cognitive because cognitive is broad concept while intellectual disability is specific in nature. That's why I am saying you the limitations in both intellectual functioning and adaptive behavior is seen in intellectual disability, while the cognitive disability is the broad concept, and where both intellectual functioning and adaptive behavior is responsible. Intellectual disability is only considered in the part of intelligence. What is intelligence? Intelligence means that is how we use our mental faculties, utilization of the mental faculties. Causes we can see, then we can more understand. about the intellectual disability. Causes of intellectual disability is genetic condition, definitely. Problems during pregnancy, this can interfere with fetal brain development. Now we can understand development of the brain of the baby during pregnancy. It makes how the intelligence of the person, the baby will be there. So intellectual disability can be caused by the problem, and there is anything is missing during the development of the baby in the womb of the mother. Another one, alcohol or drug use may also cause intellectual disability. This is not about the child, about the birth, I am telling you. Afterwards also, alcohol and drug use may also cause the intellectual disability. It also decline the intelligence of the individual. Then we will see then problems during childbirth, like a baby is deprived of oxygen during childbirth or born extremely premature. The premature delivery, sometime the premature delivery is the child is taking birth before 1 month, before few days, before some days, but extremely premature means that is the child is taking birth so before the time, so much time, before so much time of the matured pregnancy. So problem during the childbirth, like a baby is deprived of the oxygen deficiency, and childbirth or born during childbirth or born extremely premature delivery. Then we will see illness or injury, infections like meningitis, whooping cough, measles can lead to intellectual disability also. Extreme malnutrition, infections in the brain, exposure to toxic substances such as lead also cause the intellectual disability. Lead is very harmful for our brain. So that's why the lead substances which contain the lead should not be taken, because this is very harmful for the brain, for the mind, which can lead the intellectual disability. Next we will come to the physical disability. Physical disability, the nature of the disability is physical, since it related to physical functioning of the body part, including sense organs also. Physical, by the word we can understand physical disability means this is related to the physical functioning, physical, structural and functioning of the body part, including the sense organs also. This refers to limitations of a person's physical functioning, mobility, stamina, etc. This includes upper or lower limb loss, visual impairment, hearing loss, or disability in coordination with different organs of the body. Apart from these, respiratory disorders, epilepsy, and sleep disorders are also considered physical disability. So, physical disability is the disability which is due to the physical structural and functional. In the physical body it may be structural, functional. Sometimes the persons lost their organ, sometimes the people are suffering with loss of the ability, loss of the functioning of the organs, like hearing loss, vision, anything. The senses are lost. That's why the sense organs we have included here. Senses are lost or senses are poor. The person has lost their organs, like due to an accident, the person has lost their limb, hand, leg, fingers. So disability means that is the physical disability means that it occurs physically, where the sense organs are also included, the senses are also included. There are so many causes. Mostly the physical disability occurs due to an accident and illness. Mostly. Rarely physical disability can be seen since birth. We will come to the causes, then we will know more about it. So, physical disability we can understand. In this disability, the person lost the ability and the functions of the body organs. Sometimes they have lost their body organ. So, mostly it is caused due to illness and accident. Accidentally, they lost their body organ, or they lost the functioning of their body organ. Causes we will see. Causes of physical disabilities: illness like cancer, heart attack, or diabetes cause the majority of long term disabilities. These are the lifestyle diseases. Lifestyle diseases are only the diseases which the person is responsible. Due to the lifestyle of the person, these diseases occur. So, cancer, heart attack, diabetes, these are the major cause for the physical disabilities. Back pain, injuries, and arthritis also significant causes. Back pain, that is mostly caused by the spinal disorder. Initially, people take back pain lightly, but it is very serious problem when the person when it becomes severe. Injuries and arthritis. Most of the injuries are cured. Person takes it lightly. They are not doing any rehabilitating exercises. So then these injuries cannot be cured properly. Arthritis, joint pain. Arthritis is the joint pain. We will discuss afterwards in another lesson, that is osteoarthritis and rheumatoid arthritis are also significant causes. Lifestyle choices that I was discussing in the previous topic, previous slide. Lifestyle choices and personal behavior that lead to obesity are also becoming major contributing factor. Lifestyle choices, what type of lifestyle we are choosing and what type of behavior we have. personal behavior. I'm not talking about social behavior, personal behavior, how we are behaving with ourselves, our body, our physical body, our psychological body, that leads to obesity, and it is the major factor to cause physical disability. Because obesity also, the person is not physically able to do various daily routine works and various activities. That is also the disability. The person is unable to do the work he want to do, he or she want to do. Musculoskeletal disorders are also, they caused disabilities. Musculoskeletal means muscular and skeletal, that is framework, bones, muscles and bones, and their joining structure. Muscles, bones, ligament, tendons, musculoskeletal system, that is musculoskeletal disorders related to bones, muscles, and their joining structure. That disorder also caused disability, because this is the main system of the body which allow us to do various activities, especially responsible for motor activities. So musculoskeletal disorder also cause disabilities. Example includes spine and joint disorders, etc. There may be genetic cause, like gene inheritance can cause this disability. Gene inheritance, when there is change into the genes of the person. So this is all about the physical disabilities. So today we have discussed about the various type of disabilities. We will come to the disorders in the next lesson. So the disability, I think it is clear. Cognitive disability, intellectual disability, and physical disabilities. Causes we have discussed, all the type of disabilities, and the difference between cognitive and intellectual also, because there is intellectual functioning and adaptive behavior is little similar. Causes are there, factors are there. So cognitive disability, which may be since birth and may not be genetic, without being hereditary problem, the cognitive disability may be caused. Intellectual disability is about the intelligence of the individual. Physical disability is when there is the disability in which the person is physically unable to do the desired work. Organ loss, partially or permanent loss of the function of the organ. This is in the physical disability we have seen, and various causes we have discussed. So this is all about the disability. We will come to the disorders in the next video.